we do this for people who have erectile dysfunction. They'll take medications that increase blood flow, like Trimix, and you'll inject it into the penis, and you'll see an erection. So you can actually
Trimix.
So
The entire male audience just went, wait, what are you injecting into the penis?
So there are three basically brand names of intracavernosal injections that we use for erectile dysfunction.
I hear injection in penis, and I think I like to think that it reflects a natural male response. I sort of taken aback. I don't know. Maybe there's a pelvic floor contraction in there someplace.
So it is scary to hear about. It's a very small needle. It is very well tolerated. I've done it to patients in the office, and they look at me and say, "You're done." Like they don't even, it's not as painful as it seems. And when you are not having erections and you've tried multiple things, people get to the point where they're willing to try that. And so it is very effective. It is the most effective non-surgical treatment we have for erectile dysfunction. And it's usually either one medication, two medications, or three. So you can have, alprostadil, papaverine, and what's the third one?
That's okay. We can look at. Someone will put it in the comments.
Sure.
Surely they will. What is it designed to do? Is it a vasodilator of sorts?
So they work in different mechanisms, but similar to the medications that we have, PDE5 inhibitors. PDE5 inhibitors work in the erection cascade. Basically, what happens? Let's take it back to the nitric oxide thing, and we'll get there. So. Sure. Nitric oxide essentially is released by the endothelium in response to a visual, tactile, stimulating cue, right? And so your body releases nitric oxide, which then sets off the cascade for the erection. And so that releases cGMP, which causes the erection, and it's degraded by phosphodiesterase. And so medications that inhibit phosphodiesterase, like Viagra and Cialis, tend to prevent the breakdown of that cGMP, so you have longer lasting erections. And so similarly, these medications work sort of similar to that. Some of them, we don't know exactly how they work, but they work by increasing cGMP or CAMP that are involved in those cascades.
And what about L-citrulline? I hear about L-citrulline use. It's an over-the-counter supplement, and it's in the arginine pathway. Mm-hmm. And my understanding is that it works similarly to things like Cialis, Viagra, but is perhaps not as potent.